Having devoted 11 years of his life to nursing, Dan Bowen currently works on a children's ward. But in the last 2 years, he says the pressure's become so great that he's considered leaving the profession he loves.
The last couple of years, I've started to see all sorts of different stresses and pressures come in, and actually I've started to see the sort of the feeling that is driving many of my colleagues, many of my friends to feel like that. So I'm sort of in an in-between place at the moment. I can definitely appreciate that, and it's even a question I've considered myself.
And he's not alone. A survey carried out by the Royal College of Nursing suggests pressure is building on wards across the country, with the majority of nurses feeling they could walk out and never come back. More than 10,000 nurses were surveyed. 62% said they'd thought about quitting in the past year. Their top reason was stress. A further 61% said they felt unable to give patients the care they wanted because they were too busy. More than 80% said they felt their workload had increased over the past year.
The government are very quick to rely on surveys when they're saying things that are favourable to them, often surveys of a few hundred people. This survey entailed thousands of nurses, and in any other walk of life, people would take that seriously.
The Department of Health's response is to say that nurses are a precious resource. Nurses are working extremely hard and continue to provide a high quality of care in the face of increasing healthcare demands. Overall, the number of clinical staff has risen by nearly 3,500, and the number of admin staff has fallen by over 23,400 since May 2010.
There are some days when, in all honesty, you walk home and you do feel precious, you do feel valued, a smile from your manager saying thank you, but then you get other days when you're being told off because you haven't discharged your patient fast enough. So I think that's a real thing which, for many of my colleagues, many of my friends, is something which factors in our mind and think, well, is it time to go?
More than ever in its 60-year history, the NHS is under more strain. Stringent budgets, increasing costs and an ageing population is testing the service and those who work in it. Ty Genwright, Sky News.